Let me ask you something. When was the last time you tried to book an appointment with your GP and actually got in within a few days? For most Australians right now, the answer is not recently. Average wait times to see a GP in Australia have blown out to 3 to 4 weeks in most capital cities. In some regional areas, it's longer. Some clinics have closed their books entirely. They're not taking new patients at all. Yet this week, the federal government stood up and announced it was making Medicare urgent care clinics permanent, with $1.8 billion in new funding. They called it a major win for Medicare. So which is it? Is Australia's healthcare system getting better, or is it quietly falling apart? Today, we're going to answer that question honestly. First, let's talk about what Medicare urgent care clinics actually are, because a lot of Australians still aren't sure. Medicare Urgent Care Clinics, or UCCs as they're called, were introduced by the Albanese government in 2023 as a way to take pressure off hospital emergency departments. The idea was simple: a lot of people end up in emergency departments, not because they have a life-threatening emergency, but because they can't get an appointment with their GP. A sprained ankle, a ear infection, a child with a high fever. UCCs are bulk-billed walk-in clinics. No appointment needed, no out-of-pocket costs, staffed by GPs and nurses who can handle these kinds of urgent but non-emergency situations. You walk in, you get treated, you walk out free. By the end of this financial year, the government says 4 in 5 Australians will live within a 20-minute drive of a Medicare urgent care clinic. And in last week's budget, the government committed $1.8 billion to make these clinics permanent. That is a significant investment. So far so good, except there's a problem, a pretty fundamental one. The reason UCCs were needed in the first place is that the ordinary GP system, the backbone of Medicare, the foundation of Australian primary healthcare for decades, is in serious trouble, and nothing in this budget fixes that. Let's go through what's actually happening. Australia currently has a shortage of approximately 10,000 GPs. That number comes from the Royal Australian College of General Practitioners. 10,000. And the shortage is projected to get worse over the next decade, as the existing GP workforce ages and retires faster than new doctors are being trained and recruited into general practice. Why aren't more doctors becoming GPs? The pay gap is a big part of it. A specialist in Australia, a cardiologist, a dermatologist, a surgeon, earns on average 2 to 3 times what a GP earns. After a decade of medical school, internship, and residency, doctors looking at those numbers make a rational economic choice. They choose the specialty, and GP numbers fall. On top of the workforce shortage, bulk billing, where GPs charge Medicare the set rate and the patient pays nothing, has been collapsing. In 2022, bulk billing rates for GP visits sat at around 88% nationally. By early 2026, that number had fallen to 72% in major cities, and significantly lower in some areas. What that means in practice is that millions of Australians who used to be able to see their GP for free are now paying $30, $40, sometimes $60 out of pocket per visit. For a family with young children who need regular GP visits, that adds up fast. The government has not been doing nothing on this. To be fair, the 2023 and 2024 budgets included significant increases to Medicare rebate rates for GP consultations. The first real increases in years. Bulk billing incentive payments were tripled for GPs who bulk bill concession card holders, children under 16, and patients in rural and remote areas. The government has pointed to those measures as evidence that bulk billing rates are beginning to stabilize. And there is some evidence of that. Bulk billing rates in some areas have stopped falling as fast, but they have not recovered to where they were. And for the millions of Australians who are now paying out of pocket for GP visits, stabilization is cold comfort. The 2026 budget also includes $3.5 billion in total health spending increases, covering Medicare, the PBS, hospitals, and aged care. That's a substantial number, but when you distribute it across a health system that serves 28 million people, across every state and territory, across every level of care, the increases per person, per visit, per service are relatively modest. Here's where it gets particularly concerning: regional Australia. The GP shortage is a national problem, but it hits regional and rural communities hardest. In many regional towns, there is one GP clinic. Sometimes there is one GP. When that GP retires, or takes a holiday, or gets sick, there is no one. Patients drive 2 hours to see a doctor, or they don't go at all. The Royal Flying Doctor Service reported this year that it is seeing increasing demand, not just for emergency evacuations, but for routine healthcare. People in remote communities who simply cannot access a local GP and are calling the flying doctors for conditions that would be easily managed in a city suburb. This is not a hypothetical future problem, it is happening right now, and the budget measures, while welcome, are not of the scale that will turn this around in any rapid time frame. So what does this mean for you practically? If you're in a major city, the expansion of Medicare urgent care clinics is genuinely useful for non-emergency situations, and let's be honest, a lot of what people go to the GP for is non-emergency. A bulk-billed walk-in clinic that doesn't require a 3-week wait is a real improvement, but UCCs are not a substitute for having a regular GP who knows your medical history, tracks your chronic conditions, and manages your long-term care. They're a supplement, a useful one, but a supplement for people with complex or ongoing health conditions, diabetes, heart disease, mental health conditions. The continuity of care provided by a regular GP matters enormously. Replacing that with episodic walk-in visits at a UCC is not the same thing, and the system is at risk of creating a two-tier healthcare reality. UCCs for the urgent and the immediate, and very long waits for everything else. If you're in a regional area, the honest picture is harder. UCCs are being rolled out in regional centers, but the coverage is not as dense as in cities. The GP shortage in the regions is more acute, and the budget measures, while helpful at the margins, are not going to fundamentally change the workforce distribution problem in the short term. Here's the big picture question that this debate keeps circling around, but never quite answering. Medicare was built in 1984 on a simple promise that every Australian, regardless of income, would have access to affordable healthcare. That promise has been central to Australian identity for 40 years. It is one of the things Australians point to with genuine pride when they compare their country to others, particularly the United States. But promises need to be funded, and the funding model that underpinned Medicare, the Medicare rebate that GPs are paid for each consultation, has not kept pace with the actual cost of running a GP practice. Rent has gone up, staff costs have gone up, medical consumables have gone up. The rebate has not kept up, so GPs have faced a simple choice: stop bulk billing, or slowly go broke. Many have stopped bulk billing. The government has been increasing rebate rates, but it has been catching up from a very long way behind. And the structural problem, not enough GPs being trained and choosing to work in primary care, is a decade-long challenge that no single budget can fix. What Australia needs is a serious, long-term workforce strategy for general practice, better pay relative to specialists, more training places, better incentives for GPs to work in regional areas, a genuine career pathway that makes general practice an attractive choice for bright medical graduates, not just a fallback option. The 2026 budget has useful measures. The UCC expansion is good. The rebate increases help. But is it enough to reverse a decade of decline in primary care? Most health economists would say not yet. Have you struggled to see a GP recently? Has bulk billing disappeared from your area? Are you now paying out of pocket for appointments that used to be free? I'd genuinely love to hear your experience, because the aggregate data tells one story, but the lived experience tells another. Drop it in the comments. Like and subscribe for more Australian news explained simply. See you next time.